Record. And speaker view, good. Okay, let me get all set up, and then we will get going. Right there. Just making sure that there's nothing in the way. Okay, so yeah, if you have a lacrosse ball or foam roller, make sure that those are nearby because you're going to need them for today. We're going to have some crossover stretches and exercises from last time, but a lot of new stuff too. If you have any questions while we're going, feel free to unmute and ask away. If not, if you can just wait till the end, we'll talk at the end again too. So let's get started with one that we did from last time. It's going to be that 3-way hip stretch. So you'll be on your back, leg crossed over here, and we're going to start by pushing down on the knee. We're going to hold that, so pushing straight down that way, hold it for about 30 seconds. Should feel that through the outside of the hip. Got another about 10 seconds on that one. All right, and then we'll switch sides. So we'll cross the other leg over, do the same thing, pushing down on that knee, 30 seconds. Hold that, let's hold it for about another 10 seconds. Then we'll switch to the next one. All right, so next one's going to be that deep hip rotator stretch. So you're going to cross your right leg over, grab the back of that leg, and you're going to pull that knee up. So right now I'm pulling my left knee towards my left shoulder. And you should feel that in those deep hip rotators, so about right through here on the other side. So right now I should feel that through my right side. Pull that up and hold 30 seconds. And last time I was talking about this, if you're not able to get behind the knee here, just grab the ankle and the knee, you're gonna pull straight up. So left hand pulling towards the left shoulder, right hand pulling towards the right shoulder. You'll get that same stretch. All right, then we'll switch, cross that leg over, grab however you can, and pull. These three are probably 3 of my favorite hip stretches, so that's why we're doing them again. They feel good. This one's one of my favorites for if I'm getting any sciatic nerve symptoms. If my piriformis is really tight, I'll get down on the ground and I'll do this one for probably a minute, minute and a half. Nice long stretch. Okay, then we're going to bring the leg down flat, grab the top of the right knee, pull it towards your left shoulder. So you're pulling on that diagonal pattern, kind of across the body and up. Should feel that stretch. So on the other side, I'll show you. Should feel it right through this piriformis area. Pull that up and we'll hold that for about 30 seconds. Another 5 seconds or so. Good. And then we'll switch. That down. Bring that across. So right now I'm starting to get a little bit of pinching in the front of my hip with this as I'm pulling up. So my adjustment, if I'm getting that, you got to kind of work through that. I like to pull it a little more lateral and then I'll come up and then I get less pinching. So you go towards the opposite shoulder first and then you come up. Good. I'll let you guys finish that up for a little bit. Spend about 5-10 more seconds with that. Okay, so next one, we're gonna do hip fallout. So last week we did this to try to get the lower back rotating with the hips. This time we're gonna do it more for a hip stretch. So you're gonna bring your feet out a little bit wider. So a little bit wider like that. And then you're gonna let the legs fall out to the side. So you're trying to touch knee to the opposite ankle. And instead of letting the back kind of roll and come off the ground, try to keep your low back flat, your upper back flat. You should feel more of a stretch in the hip. And then you'll go to the other side. Same thing. And then if you're not really feeling as much of a stretch, kind of feels easy, you can go into more of an aggressive stretch, which is crossing the leg over and pushing the knee down. So pushing the knee down, you should feel a big stretch through that hip when you do that. So let's do about 5 of these with 20-second holds on each side. We'll just go back and forth, 20, 20, 20, 20. You should be able to feel if one side's tighter than the other. It should feel like more of an intense stretch, your leg's not going down quite as far. So for me, my left side's definitely tighter than the right. I think the right side feels better though because it's not as tight. And again, keep that back flat, keep the shoulders flat. Just get that stretch through the hip. Try to touch that knee to the ground. I'm going to do 2 more to each side. My left hip is tight. All right, 1 more each way. So again, we're doing about 5 sets of 20-second holds on each side for this. By the 5th set, you should feel your knee. It should be going farther towards the ground by now. It's been stretched quite a bit through that hip. All right. Okay, now if you have that foam roller, let's grab it. We'll start with the easy one. The lacrosse ball is not going to feel quite as good. Foam roller feels pretty good, but still a little painful. Hurts so good. Okay, so you're going to sit on top of the foam roller. You turn so you can see a little bit better. So, sitting on top of the foam roller like this. You are going to cross your leg over, so make sure you're nice and balanced, and then you're going to lean back. So the foam roller is going to be right on the outside and upper glute, and then you're going to keep your balance there. You're just going to roll up and down through that section. The more you lean back, the more you'll get into that upper glute area, which is really sensitive. And we're just going to roll up and down. 30 seconds up and down. We're calling all this that we're doing so far. This is going to be our warm up. Let's get things loosened up. So this is hitting piriformis. It's hitting your gluteus medius, which are the two big muscles on the hip that like to tighten up, limit that range of motion. So you're going from almost your sit bone on the bottom all the way up to your iliac crest, which is in your SI joint, which is the bony part in the back of the hip. Another 10 seconds, and then we'll switch sides. I'll hit the other side. Some people like to roll their IT bands. I'm not the biggest fan of rolling an IT band. I think that kind of makes things worse, and it hurts really bad. So I like to, this is where I like to roll through the hip. Even if the IT band's tight, I'll still roll this spot to try to help with it. Okay, let's cross opposite leg over. Lean to the other side. We'll roll there. If you have any shoulder issues with this, just be careful. If it really hurts, then just skip this one, because we're going to do a bunch more exercises. One other thing you could do with your knee is you could stay on one spot, and you could just actively lift and lower that knee up and down. And this is a good little active release for the muscle. So you're getting those muscles engaging. You can do like 20 of these, or you can just roll for 30 seconds to a minute. Well, like I said with everything, make sure when you're doing these, don't just go through the motions. Make sure that you're really digging into them, really focusing on getting the best stretch possible. Okay, all that good for the foam roller. So that's how I like to foam roll glutes, piriformis, those deep hip rotator muscles. Next is the lacrosse ball. Lacrosse ball is not quite as fun. You could do this sitting in a chair. You could do this on a hard bench, or today we're going to do it on the ground. So again, you'll need to use your arms for a little support. So find the bony part in the back of your hip. Find your trochanter of your hip, which is the bony part on the side, where your femur is coming in. And you want to draw a line. So from the bony part in the back of the hip to the femur, and that's where you're going to put the lacrosse ball. Okay, so bony part of the back of the hip, I'm going to come right underneath that. And I'm not going to cross my leg over because I don't really need to. It's tight enough already. You're going to roll up and down. If it hurts, you're in the right spot. If you get any weird nerve symptoms going down the leg, don't stay on that spot. You're on your sciatic nerve. We don't want to compress that. But you're going to kind of use your arms and your leg that's down. So right now my leg, I'm kind of pushing through that and holding a bridge. I'm just rolling through that tissue up and down. And again, if this hurts your shoulders to do it, then just skip this for right now. And message me, and I could show you, I could send you a video of how to do it in a chair too, or on a bench. That's about 30 seconds. Let's switch. Usually 30 seconds is about all you need with this one because it's pretty tender. So again, bony part in the back of the hip, femur, draw the line. Ball's going right underneath there. I'm going to go leg out. If you're feeling really crazy, you can go leg crossed over, but that's usually pretty intense. That'll feel like a hot poker. Spend about 30 seconds there. Rolling through that whole area. Again, make sure you're not getting any nerve pain. Spend another about 10 seconds on that. Ooh, that is tight. Sure, I've shown, if I've worked with any of you, definitely shown you this in a few different ways. Okay, so that is foam rolling and lacrosse ball rolling of the glutes. Not so fun, but super effective. Okay, so now let's get into our non-warm-up exercises. We're going to work on some hip mobility first for internal and external rotation. So we're going to do this in a few different positions. We'll start with, we'll go with the left side first. Going to be on your side here, and we're going to work on pure hip external rotation. So external rotation, hips rolling out this way. To do that, you're going to lift that bottom leg up as high as you can, like that. And this is externally rotating your hip. Seems weird, seems like the opposite, but it's not. Going to do 15 of those. And really try to focus on getting as high as you can. If you want, you could even like grab and pull up a little bit. I would just focus on seeing how far you can get on your own. Nice and slow. 15. Probably get a little bit of a muscle workout at the same time. Should start burning in that hip. Let's do a few more. Okay, so that was external rotation for the left side. Now, while we're in this position, we could hit internal rotation for the right side, and then we'll switch. We'll do the same thing on the other side. So now, left leg straight, right leg over the top, knee bent, and internally rotate your right hip by lifting your foot up this way, like that. We'll do 15 of these. Everything's going to be 15 for these. Again, focus on getting as much range as you can. And while you're doing this, you're not rotating your body. You're trying to keep all that motion coming from your hips. So hips should be facing the ceiling the whole time. Again, you might get a little bit of cramping. You might get some muscle burning because those muscles are working. We're just trying to go as far as that hip capsule and those muscles will let us. I'll sometimes use this in the clinic as a assessment tool. I'll just have people do some active range of motion and see how far they can go. So definitely a good self-assessment tool at home to see how your internal and external rotation is. Do a few more, and then we'll flip, and we'll hit the other side. Okay, so now I'm gonna flip over. We're gonna do the same thing, other side. So bottom leg, so now right leg, we're gonna work on external rotation by lifting as high as you can. My right side is definitely a lot more limited with external rotation. Make sure you're keeping notes on yourself, seeing what's tight. Because then after you have all these tools later on, you're like, okay, I was limited with external rotation. My hip flexors were tight, and you can really focus on those stretches later on. Let's do one more. That muscle's kind of burning. Okay, and that bottom leg straight, bring the top knee over again, and we'll work on internal rotation. My internal rotation is pretty terrible on this side. And I've seen a lot of people in the clinic like kind of the same way as me, where it's almost like they're shifted one way. They're limited with external rotation on one side, they're limited on internal rotation on the other side. So it's almost like their hips are rotated that way, or their capsules tightened down that way. And that could be a postural thing. So if you like to stand with your right foot flared out, you're putting more weight through it, then that could be why. Good. Let's give you a little more time to finish those up. Do about 4 more. And then let me see the best angle. I think I'll just face you. This, nope. Right there. Okay, so the next one we're going to work on hip flexion and external rotation. So you'll be on your stomach. You're just going to slide one knee at a time up. It's almost like you're trying to knee yourself in your ribs up here. So slide up, back down, switch, slide up, and back down. So as you're doing that, your knees rotated into external rotation, pulling that knee up as high as you can. And we're just going to go back and forth. You're going to do 10 of these on each side, so 20 total. While you're doing this, make sure that you don't get any flexion in the back, or you're not trying to compensate with that lumbar spine. Otherwise, it'll just get sore. Try to keep all the motion coming from the hip. So a couple more on each side. This is a lot easier to do on carpet. Yeah, let's finish those up. And then we'll stay on the stomach. And we'll do just a quad stretch. You can do this standing up. You can do it on your stomach. Just grabbing the top of that foot, pulling up. Make sure as you're doing this that your foot's not flared out. Make sure that you're pulling it straight up towards the glute. So it should be a straight line from hip, knee to ankle. So if you have tight hip flexors, you might feel this in your hips. You should feel it in your quads. Your quads aren't technically a hip flexor. So we want to stretch those out. 20 seconds. Then we'll switch. Left side's definitely tighter. And we're going to do 5 of these on each side. Again, straight line from the hip to the knee to the ankle. Don't let your knee flare way out. If you're not flexible enough to actually grab your ankle, when you're at home, you could use like a towel to throw around the top of the foot. Just pull it up this like that. Let's do one more on each side. Okay, push up, shake things off a little bit. So now we're going to work on some kneeling stretches. So let me change this a bit so you can see me better. Okay, so if your knee is really sensitive on the ground, make sure that you have some sort of a pad that you can put underneath the knee, or that you're doing it on like soft carpet. I'll just show you with the pad under my knee right here. We're going to do a hip flexor stretch first. So bring your foot out in front, get this hip or this knee behind you so that your hip's in extension. And you're just going to lean forward into that, sitting up nice and tall, good posture, so that you feel the stretch through the front of the hip here. We're going to hold that for about 20 seconds. And then rock back, kind of push down into that hamstring for a few seconds, get that stretch on the opposite leg, and then rock back and stretch that hip flexor again. So we'll do 4 more on this side, same way, and then we'll switch and hit the other side. That hamstring stretch, all I'm doing is just kind of straightening my leg out. If you have tight hamstrings, you'll feel that. If you don't, awesome, good for you. My hamstrings are really tight. Good. Rock back. Get that stretch. Rock back. Do 1 more and then we'll switch. All right, let's switch. Hit the other side. Take out in front, hip back. Lean into that. Get that stretch through the front of the hip. There's lots of different ways you can stretch the hip flexors. So you can do this way. You can do it to where your leg is up on a chair, up on the couch, leaning into it. This is your standard runner stretch. Some people do the couch stretch with the leg up. If you're flexible enough, you can put your leg up on the wall, have your heel touch your butt. That's a really aggressive version. Balance. The Airex pad under my knees give me an extra workout. Stretching into that. Good. Keep going with those. Let's do about 2 more on each side. Call this the last one. All right, then we'll go into the next stretch. Some people call this the world's greatest stretch. It's just a hip flexor stretch. Not the world's greatest in my opinion, but it's a good stretch. So, go knee down. What you're gonna do is you're gonna lean towards the opposite side, open and rotate. then come down, open and rotate. So you're in that hip flexor position, but you're just getting a little bit of thoracic rotation into that at the same time. I'll show you on this side. Do 10 on that side first. If you're here, 90 degrees, lean into that and rotate like that. Opening. So take some time, do about 10 of these on each side. Enjoy the world's greatest stretch. I guess that's what happens whenever you invent the stretch, you get to name it too. Good, so keep going with those. Finish those up, should have maybe about 5 or 6 more to do. I'm gonna get set up for the next part. Okay, so next one is called a 90-90 stretch. 90-90, okay? So from the side, looks like this. Both knees are 90 degrees. And what you're doing is you're leaning towards the side that's bent in front, so right now my left leg, and then you can either lean down and rotate, or you can have hands on stomach and rotate back and forth. But either way, leaning into that side, rotating your upper body back and forth. As you rotate, you should feel more of a stretch in the hip. Okay, so let's do about 5. Now let's do 10 on each side of those rotations. So rotate all the way through, and then rotate all the way back, and that'll be 1. So we should have had about maybe 5 done already. Make sure your knees stay at 90. Stay on myself. Okay. Let's switch. Bent. 90 degrees there. Same thing, rotating into that. And then rotating out. Rotate in. Rotate out. Let's do a few more and finish those up. All right, so let's finish up. I got 3 more that I want to do. They're all going to be in the quadruped position, so on your hands and knees. Sorry, anybody with knee issues this week, lots of hands and knees stuff for the hips. So what we'll do, we're going to do what's called a posterior chain stretch first, because we've done some ankle and toe stretching, but we need to do a little more. So toes underneath you. So you're going to put your weight through the toes right there, and then you're just going to kind of sit back on your heels, walk it back, sit back onto that. You're just going to rock up and down. So while you do this, you should feel some pulling through the toes, pulling up into the Achilles, and even into the calf. Anybody with, people with arthritis, stuff like that, I usually won't do that. Do this one with them. I'll do more post-op, like like 6 weeks out, 8 weeks out for ankle surgeries. People that just have really tight capsules, tight toes. Get it rocking, just back and forth. And I'll have them do this for about a minute or about 10 to 15 reps. This is too much. If it's really painful, then just kind of back off and do more rocking with the toes just not way up underneath you. You can just bring your feet back a little bit. Let's do a couple more. All right, shake it off. And then next, going to do the frog stretch. We want to stretch our adductors out, so I'm going to show you a couple different ones for that. Number one is frog stretch with legs out, so get your legs out nice and wide, feet behind you, so feet wide, feet behind you, and then you're just rocking back into there. You want your legs wide enough so that you feel that in your groin, in your adductors, so the inside of your leg. And again, same thing, we're just rocking back and forth. Nice and easy. I like dynamic stretching, I like moving. So we'll do these and we'll do about 20 rocks. Or if your knees are killing you, if you're on a hardwood floor right now, I'm sorry. Take a break if you need to. These are really good to do on the bed. Nice and soft. Let's do about 5 more. And then I'll show you the little variation. Because right now we're hitting your shorter adductors, so closer to the groin. And then the next one's going to hit more of the long ones that go down to the leg, because some of your adductors actually do some hip extension as well. So what you want to do is you'll still be in that frog stretch with the outside leg. So like that, but you're going to kick one leg up and out. So hip is going into flexion, leg is going out. So it's like abduction away from the body and up in front of the hips. And then you're just rocking back and forth towards that back leg again, like that. So when you do that, you should feel stretched through adductors, hamstrings, up into the groin again. Nice and easy. This is killing your leg. You can just skip it for right now or wait until you can do it on the bed. We'll just do 10 of these, and then we'll switch and we'll do the other side. Okay, switch, let's hit the other side. Back, leg out in front and out to the side. Sitting back, don't try to sit back super tight, super quick, otherwise you could get a strain. Don't want that. Back and forth, 10 of those, nice and easy. Couple more. Good. All right, then carefully come out of that. Okay, last one. I want to do a posterior hip capsule stretch. So what you're going to do is you're going to be quadruped, so hands and knees. Cross your right leg over your left. So like that. And then what you're going to do is you're going to sit back towards this right side. Stretch that out. So just sitting back. Keep that crossed over. Sit back and get that stretch like that. Okay. So legs crossed over. Sit back at an angle. We'll do 10 of those rocks. All right, switch legs, cross the opposite leg over. Sit back into that. You should feel that. So on the other side, I'll just show you on this side, you should feel that right through here. Ten more of those. And then you're all done. And again, if anybody had any issues with these, if you were doing some and you're like, yeah, I couldn't even get into that position to do it, just hurt too much, just let me know and I can send you some variations of these. All right, couple more. Okay, so that is it for hips and lower extremities. Again, if anybody had any pain, let me know. Or if you guys want to unmute, feel free to ask questions. Starting next week, we are going to start putting everything together. So it's going to be head to toe, whole body kind of versions of everything that we've been doing up to this point. So weeks 4, 5, and 6 will be just 3 different 30-minute routines to where we're going to hit everything. Okay. Does anybody have any questions about anything?
No, but thank you very much.